Welcome to the Bipolar Buzz podcast, where we slice stigma surrounding mental illness one episode at a time, and we give others courage to do the same. I am your host, Lay, a wife, mom, daughter, sister, coworker, and friend who also lives with bipolar 1 disorder. So, without further ado, let's slay. There are many barriers to accessing healthcare and, in particular, mental health care. And I think that one barrier that sets mental health care access apart from traditional or physical healthcare access is stigma. There is stigma that's associated with mental health and mental health conditions, especially serious mental illnesses like bipolar disorder and schizophrenia. But you don't see that same stigma attached to things like hypertension, diabetes, cancer, etc. So I think that combating the stigma is one huge way to make mental health care more accessible for people who need it. And the reason I bring this up is because in the news lately, there are public figures who have been open and honest about their personal struggles and experiences. So Senator John Fetterman of Pennsylvania, he actually suffered a stroke last year, and I don't think that the stroke was directly related to his seeking inpatient care for clinical depression in February of this year. He said that he struggled with depression on and off for a good bit of his life, but it's gotten worse recently, and so he was admitted to Walter Reed. And I really commend and appreciate his openness about what he's been dealing with and what he's been struggling with. So he said it was hard for him to get out of bed, his motivation was super low, and he just wasn't himself, and he knew that he needed to seek help before things got worse. And I think that really opens the door for a larger conversation. I saw on ABC News there were four more Congress members that came forward to speak up about mental health and about how they kind of deal with their mental health. And I think it's so important for public figures especially to kind of use their platform to raise awareness in order to reduce the stigma, especially political figures, because we know that they're involved with the policy making and the legislation and the governing, but this makes them more human. It makes them more relatable, and their constituents can look at them and see themselves in that person as someone who's actually representing me, someone who has kind of walks in my shoes in sort of a way, and who can relate and understand, and who's able to create policies, pass policies and laws that actually benefit people like me or people like us, because you get it. And to me, the greater picture is that mental health does not stop at acknowledging that you have some sort of a mental health issue or a mental health concern. It goes beyond that to actually seeking treatment when you need it, to seeking professional help when you need it, to actually taking the steps to recover and to better yourself and to heal from whatever it is that is hurting or harming you. So another thing that I've really been thinking about as it relates to stigma and access to care is something called self-stigma. And that's when you internalize the negative attitudes and the negative perceptions, and you kind of shame yourself. And that can keep you away from accessing care and to accessing resources as well. But the more that we share, the more that we use our platforms to really speak up and to be open, I think the more the barrier, the walls are going to come down, and people are going to realize that your mental health is just as important as your physical health. John Fetterman is expected to return to the Senate next week, and I just hope that the conversation continues surrounding mental health, and that access to mental health is coupled with us trying to destigmatize what's going on. And so I think that normalizing mental health struggles and normalizing mental health disorders, normalizing seeking help, normalizing being free and open to talk about what you're struggling with is a huge way to try to eliminate a barrier that people are faced with when it comes to accessing help.
Thank you for listening to this episode of the Bipolar Buzz podcast, where we have the courage to slay stigma. If you like what you heard, be sure to subscribe for more and share with a friend.